Happy end of the week, friends. I am recording a little bit earlier than Friday. So we are recording the afternoon of September 4th. And boy, has a lot happened since we last spoke on Friday. So let's get into it. First of all, Wisconsin is now involved in another lawsuit. Late Friday afternoon, Wisconsin again joined another lawsuit raising questions about the Centers for Medicaid Services use of the data that states, including Wisconsin, are required to provide about Medicaid members. So on August 19th, CMS announced that it was going to be giving states lists of people, names, addresses, etc., with every month and saying, hey, this list of people, these are people whose citizenship and immigration status is unknown. And that kind of implies that it's a list of people who perhaps are in Medicaid and shouldn't be, but that isn't exactly true. As you know, if you have attended these webinars before, undocumented immigrants are not eligible for Medicaid, and our counties in Wisconsin do an excellent job of verifying that everyone who is in our Medicaid system is eligible to be there. There are a few groups of people who do have who are immigrants but are here on some legal status pathway, who may be eligible for some parts of Medicaid. And then, of course, federal law does require that all hospitals and clinics provide emergency services to anyone who needs them through the door. So these lists it's kind of unknown how they're being generated and whether it's only Medicaid data or perhaps different sets of federal data sets that are being combined. But CMS has announced that they're going to give every state a monthly report and essentially frame that as, here's a list of people that we can't say are citizens, and so we're going to perhaps make a case that they might not be and shouldn't be in Medicaid. It also said, hey, now that you have these list states, you're going to be responsible for figuring out whether or not those people are supposed to be or not supposed to be in Medicaid. Again, we've already determined eligibility and know that we have a error rate of like literally 3 people who have been determined not to be eligible for Medicaid out of more than 1.2 million. So it kind of feels like this list is generating more work for a state that has already done a very good job of making sure everybody's eligible for Medicaid. And CMS really hasn't said what states are supposed to do with this, or with these lists, or made any other given any other instructions. But they did say that they would be monitoring states' progress on these monthly lists, and it is unknown what steps CMS might take if they didn't think a state was doing enough or did not take actions that they wanted. That's unclear. So our attorney general said, hey, wait a minute. This is not why states are providing Medicaid information to the federal government. This is not our expectation. And also, we have a very small group of people who are non-citizens that can access Medicaid. We aren't a state that's using state dollars to offer Medicaid-like services. So why are you giving us extra work that in theory we've already done? And there's a lot of reasons to think there might be some mistakes on on these lists. For example, we have lots of people whose immigration status may change. Maybe they go from a temporary to a more permanent status. Or maybe you have a newborn who hasn't been assigned a social security number. There's certainly a lot of reasons where somebody could end up on this list and not really, it wouldn't really be appropriate to say that they are somehow doing something wrong. So this is an additional case. We already have an ongoing case about Medicaid data being given to other federal agencies by CMS. And it's yet another part of a pattern where data that the state is providing, because it has to under federal law, is being used for some unknown purposes without the state's permission for unknown reasons. And we'll see where these cases end up going. So there's been a little bit of coverage. Last week, we talked about some new information that the Department of Health Services released about how much the changes to the food assistance program that was in the reconciliation bill would cost the state. You might remember that, first of all, more people are subject to the existing SNAP work requirements, a larger age group, and some groups of people who were exempt from those work requirements before are not now. So if you have more people that have to meet requirements, that means there's more work for county workers to figure out who is eligible for SNAP or not. And there's also now starting to be some coverage of from food pantries who are saying, hey, we see a lot of families, and we're seeing an increasing number of families, and many families are using both the food assistance from the state, and it's still not sufficient to meet their needs to eat. So we're seeing families show up at the food pantry who are also already on SNAP. And this was a nice local article that was starting to talk about the community impact of what potentially losing SNAP benefits could mean for many families and in the community in large. The Marathon County Board has already approved, I think they said it was a piece of legislation, but I think they meant county resolution, asking the state to supply the additional funding needed to make sure that the state stays compliant with the new requirements and to offset some of the budget holes that those funding cuts have caused. The Wisconsin Counties Association is asking all counties to pass resolutions on SNAP changes. And you can see there is a link here. That is a link to the county resolution. So if you have connections to folks who are serving on the county board, or perhaps other county workers who may have connections to people on the county board, you can make sure that they know that this is not only a resolution you think would be helpful, but that the Counties Association is actively asking for counties to do this, in part to help make a case to the Wisconsin State Legislature that they should really increase the amount of funding for SNAP now that these cuts are in extra costs that we were unaware of in July are coming home. And the counties are doing a little bit of good work to help let people understand that when you change these administrative requirements, it actually really does change the workload. Somebody has to actually do the thing, whatever the thing is that's been changed. And so they're really trying to help folks understand what county income maintenance workers are doing. And these are the same workers, by the way, who are helping people navigate the Medicaid eligibility and application process. So there's an awful lot of work directly with families to help people understand, are you eligible? How do we, reflect changes to your situation, and really helping people understand that these are workers who have a lot of expertise and do a lot of one-on-one service with families that takes time. So it isn't just that you can increase the amount of work that this group of workers has to do without adding more workers and have the system keep working the same way. So the purpose of the resolutions that the Counties Association wants counties to pass is to really help make the case and help share, here's what we already do, and now you want us to do more. So we need more support from you to do as good of a job or better. And there's certainly a lot of reasons that this bill that passed gives us to want to keep our accuracy and our ability to do that job high. I received a call last Friday from a grassroots person who had taken the initiative, which was a great idea, to meet with somebody who was running for elected office. This was not an individual who is a currently elected lawmaker, it's somebody who wants to be one. And she had some of the questions that we've been sharing over the course of the last 9 months that are really top of mind for a lot of people. Hey, these changes, there are Medicaid prove you're working or exempt requirements coming. I want to know how do I prove I'm a caregiver, or how much caregiving do I have to do, and all of the questions that not only we've covered in these webinars, but that you've asked us, and we've included as part of the questions that we're raising with others. So she had a list of questions that she asked this member of Congress, or not, or prospective member of Congress. They're running for a seat, and was surprised that that person didn't have really any answers, and actually referred her to her state legislature as the person who would have a better sense of what to do. And I think that, first of all, it's always good to set up meetings with your existing lawmakers or with candidates and really help them understand the questions you have and why you have those questions, because many of them aren't aware of the realities of people's lives that we're all familiar with. So there's always value to that. And a smart lawmaker and a smart candidate will hear those questions and go, that's not a bad question. And if I don't have an answer, at least I should be able to understand why this person is concerned and talk about that concern, and maybe be able to point to somebody who voted for those changes that have caused all the questions and ask them those questions when I'm running for office. And maybe I can think about how do I talk about the issues that we are all concerned about to a broader audience as I'm going to events, etc. But that is not what happened in this case. And I think it's important to remind ourselves that as we are looking to others to provide answers, we should be aware that we are the people who sometimes have the best answers and the best perspective. So even when you feel like the person you're talking with doesn't have the answers, don't accept their non-response. Don't accept when they say somebody else has to deal with that. No, there's no more pointing of fingers. This has passed, and now everybody is responsible for helping to figure out how to do it, hopefully with the least harm possible to the fewest people possible. So it is probably a good time to think about, if you're looking for things to do, think about meeting with those federal candidates. Maybe you have an event coming up, or you have, you're a provider and you may have some clients coming in. What if you are not currently an elected official, what are you going to do if you either get elected to Congress or to the state legislature? How are you going to address what people are worried about that is coming because of some of these federal changes? If you have a current federal lawmaker, what are they going to do to undo the harm? to make a better or easier system for the people who actually have to use it, as opposed to creating a system that's harder and hoping fewer people get in the door. And for state lawmakers, now this has passed, and through the spring, a lot of you were talking to your state legislators about how you were very concerned about federal changes, and you kind of got an answer of, well, nothing's happened yet, and blah, we don't really know what the thing. Well, now things have happened. And now there are some estimates coming out of what it will cost the state. And now people are starting to think about, what does this mean to my community and my family and my life? What happens if, we are in a situation where I think I'm exempt and it turns out I don't meet the exemption? Or I know I can prove I'm working, but I don't work enough. These things are now no longer abstract, they're real. And that means that state lawmakers don't have the excuse either to say, we don't know what we're going to do. And they also don't have the excuse, because you haven't let them have an excuse of saying, well, I don't really know what's going on. If they say that, that's okay. You can educate them, because all of you have been thinking about these things for 9 months now, about what Medicaid means to you and what food assistance means to you and what it would mean if the help you had now was different or less. There are some people who have responded, and they're running for office, that there's nothing they could do, or that's somebody else's problem. And I think that one of the questions that you have, if somebody is running for office, they are running because they want to be in a position to make decisions. That's what lawmakers do. They make decisions about what to say publicly to help elevate messages. They make decisions about what bills or legislation they choose to introduce or choose to support. They make decisions on what kinds of things should be funded or not funded. Like, being a lawmaker is about making decisions. So there's never a point where there's nothing a lawmaker could do. There is sometimes a point, there may be a point in where they may be more or less willing to do something, but that's a different question. And I do feel like I've heard from a number of people, not just one individual, but a kind of collective response about, well, there's nothing that we can do, or like somebody else is responsible. But actually, everybody is responsible, and lawmakers are the people who are elected and put in positions to assume that responsibility and make decisions, and hopefully be listening to constituents to help make them those constituents. So if you don't want to make decisions, then why are you running? And the reaction that I've gotten from a number of people who are talking with, these various candidates, and who are, potential voters for these folks, a lot of them have come away hearing those kind of answers and saying, well, what's my reason for voting for you if you can't do anything once you're in office? I want somebody in office who's going to be pushing on these issues that you've been pushing on for a long time, and that are really important to whether or not people get to live in their own homes, or get out of bed in the morning, or get enough to eat, fairly basic things. So that's what I mean by, it's time to start challenging some of your lawmakers, because the time where they could honestly say, we don't know what's happening, or nothing's happened yet, that is now over. These things have passed. And yes, some things could change, but we aren't in a landscape where we know things will change. We're in a landscape where a bill has passed that has made changes, and states will need to do things because of those changes. And that's the reality that we're in now. We've set a deadline for the Survival Coalition survey, and it's September 19th. So there is still still time to get this out to your friends and share the survey and take it yourself and get it to all of your clients and other folks. We're about a little over 40% of the way to the goal. So for those of you who have been, where the last minute is a good time for you to tick off a task. It's not quite the last minute, September 19th, but we now can see it on the horizon. So if you haven't taken the survey, take the survey. All right, Congress is back. They've had a nice long break. Some of you may have had some vacation as well. Others of us have been watching and having a lot of things to talk about all the way through August. And now we have even more to talk about because Congress is back in session. So here's where we are. We have had a lot happen in the last few days. A pocket rescission bill has been introduced. The House has held a markup hearing on one of the biggest bills that has the most things of importance to people with disabilities and older adults in it. Today, actually, as we speak, the Secretary of Health and Human Services, Robert Kennedy, has been called to Congress for a hearing. We've had a number of federal agency changes happen, and you can see that we have a pretty tight time frame for a lot of activity that needs to happen, not only between now and September 30th, which is 26 days away, but really the rest of the year. So the next 4 months, there's a lot of things that are packed into this time frame. We're going to spend some time talking about the 2026 federal budget because that is kind of the first item. That's the first crisis point on our agenda. The federal fiscal year ends September 30th. So Congress kind of needs to either pass a budget or pass an extension of the current budget to give itself more time, or the government shuts down as of October 1st. So there's a number of developments now that we have a very tight timeline to have something happen that we'll talk about. We've also had a second rescissions bill that has been introduced, and you may remember that this has been something we've been talking about all August. Whether or not the administration was going to ask Congress to not spend money it had said it wanted to spend in September in 2025, and there were a lot of members of Congress who didn't want the administration to send it more rescissions bills, and they have as of August 31st. There's still discussions about whether there should be a second reconciliation bill in this fall, and potentially some discussion of independent legislation, healthcare legislation, that would come this fall. They may or may not deal with the expiration of the Affordable Care Act marketplace subsidies. And if they do choose, Congress does choose to extend those subsidies, it may not be in its current form, and it may not be without cuts to other programs to offset those costs. We also have a potential for automatic cuts across the board at the end of the year because the reconciliation bill that was signed into law July 4th, also known as HR1, had so much added so much to the federal deficit that a different law kicks in that says, well, if you add too much to the deficit, then you have to cut existing spending kind of across the board. So that's got to get settled and resolved within this time window. And then a couple of ongoing strategies that we have seen really all year that may influence how Congress is thinking about not only the federal budget, but are they going to resist the idea of approving spending that then never gets to where it's supposed to go? I'm going to flip through a couple of questions as per usual. We always want to leave you with some questions that you can ask your member of Congress. And these are a couple that are just based on all of the things that are needing to get resolved that Congress has to choose to make decisions on. So where are we on this 2026 federal budget that technically needs to be done September 30th or 24 days from now, but who's counting? Right now, both the Senate and the House are not optimistic that they can get the full budget done. And to longtime watchers of Congress, there is very little surprise in that. Congress, I think, has not passed a budget on time in several decades, and they have increasingly used a strategy to approve short-term funding and essentially move the crisis point when the government runs out of money and shuts down to a different day, right? We call that a continuing resolution. And essentially, it keeps the government open and moves the deadline when the federal funding stops flowing. And then that new date becomes the new deadline by which Congress either has to pass a budget, pass another continuing resolution to extend that deadline again, or shut down parts of the federal government. There's a difference of opinion between the US Senate and the US House, but there's certainly more and more interest in passing some version of a continuing resolution. In other words, moving that crisis point beyond September 30th to some other date. And the House has kind of this week said, maybe we pass a CR that gets us to November or December. And remember that timeline, there's an awful lot of other things that have to be resolved besides this budget by December, right? There's also some folks who want a full year continuing resolution, but in exchange for that year of funding, they also want to include more spending cuts and policy changes that they want. And there are other folks that have a different idea, and this has become, in the last couple of days, you floated a little more routinely. There are 12 appropriations bills that are part of the federal budget process. And there seem to be some smaller bills where there isn't a lot of conflict. And so there's a group of senators that says, why don't we pass apparently 3 appropriation bills that pretty much there's no disagreement on. People agree that that's okay. And that would mean that anything funded under those agencies where we pass their appropriation bills has some certainty, for the whole year. And then we can kind of do a continuing resolution on the rest of the stuff and figure it out later. So that means that some government programs would have a guarantee, would at least have the agreement from Congress on what Congress intends to spend on which programs. And then it would leave a lot of other programs continuing to wait for Congress to see if they get more or less money in their 2026 funding. Now, there are a lot of Democrats who are very worried, specifically about some of the strategies the current administration has been using this past year that have stopped money Congress has approved from getting to where it's supposed to go. So the administration has simply not sent money out, stopped payments. It has also put conditions on funding that Congress has not put on funding, and that has in some ways delayed or even stopped some funding going to states or other contractors or universities where it's supposed to go. And there's also been now 2 rescissions bills introduced. One passed July 18th on foreign aid, and now a second one that's been introduced very close to the end of the fiscal year. And Democrats have been specifically worried about all of these things, but especially the rescissions bills, because it makes it very hard for them to negotiate and say, let's come to an agreement on what we think the federal government should be spending its tax dollars on. If then the administration simply decides that they're not going to send money out, or says to Congress later, actually, we're going to ask you for permission to not spend the money. So that's kind of an overarching problem over the whole budget process, where we have Congress that's trying to play by the rules that it has always had about passing appropriation bills and talking about CRs and talking about whether or not to shut down the government or keep it funded. And it's being done in a very new landscape where some of those decisions that they made as part of the last budget have been undone or not followed through on by the executive branch. And that makes many Democrats very nervous about agreeing to anything at this point, because they don't know if it's going to be undone without their consent or permission. Congress has been, the word is complicit. They have allowed the executive branch to do these things and have not questioned them so much. But once sometimes you kind of don't say something, it almost acts as a permission structure for that entity to keep doing what it's doing, because you didn't object to it, so it must be okay. And I think that's one of the questions that advocates can have as we're talking about, doing the normal business of the federal government deciding what to spend the tax dollars we pay on, that how are they going to make sure that the programs we care about, which include disability and aging programs, are going to get funded at the same levels, and to make sure that that funding gets to those programs. So just a little bit about the federal budget process. Some of you have heard this before. There's 12 appropriation bills Congress has to pass, and each appropriation bill covers different federal agencies. So there's an appropriation bill for, say, the Department of Defense. There's an appropriation bill for the Department of Labor, Health and Human Services, and Education. That's all one bill. So there's various bills, and they essentially cover different agencies that do many different things. Like any piece of legislation, both the U.S. Senate and the U.S. House have their own version of the same bill, and they work through committees to develop the language they want, and then they have to agree to that language. And sometimes the bill in the Senate and the bill in the House look pretty similar, and they may have to tweak some of the language a little bit. And then once the House and the Senate has passed that bill, it goes to the president's desk. And sometimes the Senate version and the House version of a bill are very different. And that means that somebody or somebodies have to compromise a lot, because you have to have the same language pass both of the House and the Senate to become law. So of the 12 appropriation bills, the biggest spending category that is not part of the defense budget is the Labor, Health and Human Services, and Education bill. That has the most things that are important to programs to people with disabilities. Funding for Medicaid, Medicare, the Affordable Care Act, all of the disability and aging programs, special education, DVR, it's all in that one appropriations bill. There's some other appropriations bills that are important as well. For example, agriculture is where the food assistance program stuff is, transportation and housing, public transit, and the Department of Housing and Urban Development. Those things are important as well. But really, if you had to pick one of the 12 appropriations bill where the most stuff is that impacts people with disabilities, it's the Labor, Health and Human Services, and Education bill. And the U.S. Senate has already acted on this bill. They passed not the full Senate, but the committee passed its version of the appropriation bill July 31st, and then they went on vacation. The House said, we're not going to do anything with this bill until we come back in September. So here's what we know about the Senate bill. First of all of the disability, aging, and education programs were funded at about the same level. And all of the same structure that we had before was in this bill. So you may remember in the spring of this year, there were a lot of staff firings at various federal agencies, including the Department of Health and Human Services, and some reorganization of different parts of the agency, including the Administration for Community Living. In fact, the agency, Department of Health and Human Services, said it wanted to eliminate the Administration for Community Living, which is where all the aging and disability programs are, and had a number of other ideas about what to do with those programs, and fired the ACL staff. So lots of you took action this spring and really made a strong case that not only do aging and disability programs belong together, and that there was a reason they were all put in the same agency, but it was really important that all of those different programs remain separately funded, not lumped together and thrown into a block grant and sent to the states to figure out, for example. So we were unclear how the Congress was going to think about what has already happened within the agencies. And what the Senate committees did is essentially say, nope, we think we're gonna pretend, ACL exists in our mind because we never decided that it shouldn't. And all of the programs underneath ACL are going to be independent. And we are going to do a budget that assumes the structure that we had in December of 2024 is what we have now. The committee had a nice report, was very clear about funding amounts for individual programs, and had a lot of guardrails in the report that were trying to direct the department about how they wanted money to be spent. And the full US Senate hasn't passed the committee's recommendations yet, but it is a very clear signal that instead of going with some of the proposals in kind of the president's wish list, the president put out their version of how they wanted a budget to look. It's called the President's 2026 budget. And there were a number of things in there that are the Congress looked at that and said, no, we're going to go back with the model that we had before. Thank you very much. And fund it that way. And this week, September 2nd, the House Appropriations Subcommittee also held a hearing on its version of the Labor, Health and Human Services and Education budget. It is different than the Senate version. This bill hasn't passed the full committee or full House. And yes, the Senate and the House version are going to have to agree. But there are some really good signs within the House version of the budget that there is agreement between the House and the Senate on some things related to disability. So what's in the House bill? Because we've been talking so much about Medicaid in the past 9 months, and specifically one of the things that advocates have been hearing repeated over and over is this idea that there's a lot of fraud, waste, and abuse in Medicaid, which is demonstrably not true. It did want to note that there is almost $1 billion that's been allocated for finding and in funding for fraud, waste, and abuse work. And that includes an increase of $630 million to do more of that work. So there's definitely you know, a greater amount of money than there has been before, quite a significant increase, in fact, to look for fraud, waste, and abuse. In the House bill, once again, and we don't have the budget tables yet, hopefully that will come out in the next week. The budget tables are where they go through line by line and show you all the programs and what they are funded at individually. So we don't have that, but we do see in this bill that the Administration for Community Living exists again, just like the Senate bill. So that again leads us to believe that the House is not recognizing, you know, the federal agencies' efforts to dismantle this group without their permission. And they want to fund the Administration for Community Living and presumably the things that are housed underneath it separately. So we will see, hopefully in the next week, how the House is thinking about funding each program. It is, I think there was an $11 million cut to the entire Administration for Community Living, which is not a lot given that their budget is, you know, about half of $500 million, I think. But it does look like, you know, perhaps we should have a reason to be hopeful that some of the ideas in the president's budget are not the House does not agree with. There are some interesting things that the House includes about more data collection requirements on how much the federal government is spending to run the federal healthcare exchange. And that's interesting for us because Wisconsin actually, there are some states that have a group of workers and they run a state-based exchange where if you are in the Affordable Care Act marketplace, those are the people that you go to help you figure out how to navigate and pick a plan and all of those stuff. We don't have that in our state. We use the federal ACA marketplace. That's how our 313,000 people who are in the Affordable Care Act, that's where they sign up, essentially. And there's a requirement to provide the budget committee, that's what a big long word of appropriations, with how many people are enrolling. I don't know if that's something we've seen before, but you know, it stands out because it is Congress taking an interest in how much money does it cost the federal government to support people's ability to sign up for the exchanges. And how many people are using that service. And sometimes that can be an indication of they're looking for data to help them decide how to change something or make future cuts. There's also some language in the House bill that really puts an emphasis on none of the money that we're giving this agency can be used for implementing these rules. Some of these rules, specifically the nursing home staffing requirements, we're already kind of covered in the reconciliation bill. There were a couple of rules, Medicaid eligibility improvements, and also nursing home staffing that HR 1 said, no, you can't spend any money on implementing those rules. So it's a little bit odd that you see it repeated here in an annual spending bill. But there are quite a few rules where Congress is saying, hey, you know, we're giving you money, but not for these things that are rules that exist on the books and technically should be followed. We're telling you not to spend any money to do them. The other good, interesting thing in both the Senate and the House bill is that the Department of Education still exists. Again, that was another proposal and piece of discussion that the president proposed, eliminating the Department of Education. So Congress clearly at least in these committees, has decided not to do that. It has decided to create its budget bill under the current structure, which includes an education department. And that's important. There are some cuts here, and some of those are kind of in keeping with what the president proposed. There is a $4.7 billion cut to Title I funding, which is money that goes directly to support schools that have a pretty high population of students who are really low income. And there are lots of students with disabilities who also are low incomes or are in districts where that there's a lot of people, students that fit that profile. So that's definitely a pretty big reduction in a formula program that school districts have relied on to provide support. However, there's a small increase in special education funding and a relatively small increase in Division of Vocational Rehabilitation funding. There is another cut to the Office of Civil Rights. And you may remember in March that about 40% of the staff in the Education Department's Office of Civil Rights was eliminated. And about 50% of the cases that the Office of Civil Rights works on are cases about students with disabilities who may not be getting what they are entitled to under the IDEA, which guarantees students with disabilities the right to a free and appropriate public education. So this is in line with what the president's budget proposed. And you can see it's another reduction on top of the staffing reductions that have already happened. So you kind of can look at that and say, okay, they're continuing to de-emphasize civil rights enforcement in the Department of Education as being an important thing to fund. Also, last Friday was a very busy day before the holiday weekend. The Office of Management and Budget Director, Russell Voigt, did send a second rescissions package to Congress. And you may remember that he sent a first package, which was passed July 18th, that removed about $9 billion in funding from foreign aid and the Corporation for Public Broadcasting. There were lots of members of Congress who did not want him to send more rescissions. And the reason why this one is noteworthy is because it is done within a window of time where it seems like no matter what Congress does, the intent is that that money will be clawed back. Let me explain. Now, this particular rescissions bill is again focused on foreign aid, so it does not directly relate to anything funded for people with disabilities. However, it is important in the sense that this is a strategy that is untested, that is being tried here. And it's being done so close to the end of the fiscal year that the claim is, even if Congress says, no, we want to spend the money that we said we would spend in 2025, that the Office of Management and Budget will say, well, we still have the ability to stop payment on that. And if we stop payment, we'll run on out the clock. And the authority to actually spend that money ends on September 30th. So we've kind of got a little bit of a game of chicken. Now, we can also say that if this money hasn't been spent and Congress hasn't said anything, and we're like at the end of the fiscal year, there's plenty of reasons to wonder why Congress hasn't been asking why that money hasn't been getting to where it needs to go and pressuring the administration about it. But this is where we are right now. This is likely not, at least in our current understanding of the Impoundment Act, this is likely not legal. There are some narrow reasons that you might be able to do this, but this does not seem to meet those reasons. And it does seem like there are Republican members of Congress that expect there could be more requests coming between now and September 30th to not spend money that was appropriated by Congress for this calendar year of 2025. In addition, the Office of Management and Budget has revised some of its guidance on the Impoundment Act to federal agencies. And the Impoundment Act really governs when the Office of Management and Budget can, stop payment or not spend money Congress has appropriated on schedule. There's reasons why that might happen. Say you have a big infrastructure project, for example, and you thought you were going to be ready to pour the concrete on a certain date, and you're not, for whatever reason. The plans weren't right, the permits didn't come through, you've had a hurricane, who knows? So there are reasons why you may want to have some flexibility to say, we can't spend money now because of X reason, but it doesn't mean we're not going to spend the money. So there's a whole act on this. And what's important about this guidance is this is the directions the Office of Management and Budget is giving to all of the other federal agencies. And they're essentially kind of making it seem like the impoundment, the withholding of funds isn't a thing to be worried about. They're also making some pretty clear statements about independent agencies, specifically the Government Accountability Office, which is kind of functions like Congress's advisor, much like Wisconsin's Legislative Fiscal Bureau, where it's an independent voice that does research projects and other things on Congress's request about all sorts of issues, and also a lot of budget analysis. So it's of note that the Office of Management and Budget is telling federal agencies, if the GAO says that it's an impoundment, don't worry about it. We are going to decide that their work and their opinion about whether what we're doing is okay does not matter. They also changed the guidance to claim that there is authority to do pocket rescissions, which again is untested and most experts say is illegal and what they're trying right now. And they also claimed a lot of authority to do deferrals, which is another strategy to not spend money as it is appropriated by Congress. They also have sent a letter to our friends at GAO saying that we're not going to cooperate with you anymore. If you want to do oversight on impoundments, we don't think we have to cooperate at all. So that's a pretty strong statement about how the Office of Management and Budget at least thinks about its authority on whether or not to spend money or release funds and who they are accountable to. Which raises the question, now that we've had 9 months of Congress, not really knowing what money has gone out or not gone out, and when they know that money hasn't been appropriated as they intended, what have they done about it? These are relevant questions for the moment. How are you going to know if you are passing a budget that funds the federal government? Up to this point, we have assumed that budget matters and that money will go out as intended, because that's what's always happened before. But the last 9 months, that hasn't been what's happened. So how does Congress know where those dollars, whether those dollars are flowing or whether they're being blocked up and held? How are they going to figure that out? And what are they going to do about it if they find that some of the things that they wanted to fund aren't getting their money? Lots of people have been, we've talked about a number of federal court cases that are happening. States are doing a lot of cases. Wisconsin's involved in many lawsuits. It really is hard to keep track of. I think that the main takeaway is the courts aren't going to necessarily resolve these issues, and they certainly aren't going to do it in a timely enough manner if you're the organization that's waiting on federal dollars that aren't coming. And I think that's worth noting because I think there's a lot of people who are kind of hoping that there will be some magical ruling and then it will be decided. But that is not how other experts are starting to see it, and specifically on this idea of, will we get a very clear ruling on what everybody presumes that they know, that Congress is actually the the group of people that has control over how federal dollars are spent. They may not take a case that is going to provide them an opportunity to make a clear ruling in the near future or even this year. One of the other outstanding items that Congress will have to deal with this year is whether or not to extend the Affordable Care Act subsidies. HR 1, the reconciliation bill, did not do that. Congress made a choice to let those subsidies that help keep marketplace premiums low expire because they didn't do anything to extend them. And in the last month, while you've been on vacation, a lot of insurers have said, hey, if people don't have those tax credits that keep their premiums low, and we have rising healthcare costs, and the reconciliation bill did make a bunch of changes that are being estimated to make it harder for people to get or stay in plans and might make them lose coverage. And there's an administrative rule that's kicking in that makes more changes. And we have potential tariffs that might impact drug costs. All of these are reasons why insurers have been reestimating what their rates are for 2026, and they're a lot higher than they are right now. So some members of Congress are very aware that their constituents are going to start seeing huge increases in healthcare costs. Probably starting in November is when people are first going to see, what will my plan next year cost me, and when you have to re-enroll in Affordable Care Act marketplace exchanges. And if Congress does nothing, those tax credit subsidies expire at the end of the year, December 31st. Now, even if they extend the subsidies, it doesn't mean healthcare costs are going down. And there's still been a whole bunch of other changes that they've made in the reconciliation bill that will impact coverage. So just extending the subsidies doesn't mean that your premiums you have now will stay the same. It kind of means that they're going to go up maybe less. So we shouldn't be thinking that if Congress chooses to act and the subsidies are extended, that means everybody's bill goes way down and we're back to normal. That isn't the case. But it is unclear whether or not there is enough political will to get this done. And there have been a few articles out in the last few days that that kind of call into question whether there's enough interest in doing anything for action to happen. There are some, there's a reference to a meeting, and we'll cover it next week, where we've talked about certain kind of conservative interest groups having additional ideas for Medicaid cuts and other healthcare policy. There's certainly been talk of a second reconciliation bill. There's also been talk of a second healthcare bill. And we've also talked about, sometimes if you want to do one thing, that doesn't mean it doesn't come at a cost for something else. So there are some folks that might be interested in extending the ACA subsidies, but it costs some money to do that, about $300 billion over the next 10 years. And there's also a lot of people who, whenever there's any amount of money that's being spent, don't get really nervous about that or want to say, well, it's fine if you want to spend more money to do this, but that means you have to spend less money somewhere else. And there's certainly been a number of folks who have been tying together, well, if we extend the ACA subsidies, that will mean we can offset that by making more Medicaid cuts. So we will monitor this and see where it's going. If there is a bill, I think we should be prepared that we will have to look at it very closely to see what changes are actually being proposed for the ACA marketplace and whether it will in fact, make it easier or people get as much support as they have now, and also what other things are included in that bill that might have an impact on either the same people or other people who are not in the exchanges. Big question is, hey, healthcare costs keep coming up, and there's a lot of changes in HR 1, both with cuts to Medicaid and changes to the Affordable Care Act that are going to mean higher costs for everyone. So it is unclear about what Congress is actually going to do to stop or slow down or reverse much higher healthcare costs. At this point, we have a system where the costs keep going up and insurers are trying to negotiate and they would like to pay the least amount possible of those costs. And once you get to the point where the hospitals and the insurers have agreed on what they're billing and what the insurer is paying, the only other person that pays the bill is the consumer. And for more and more people, high bills or high bills that where there's only a certain amount that's covered mean they end up with bills that they can't pay, they can't control, they can't afford, and that they can't avoid. So this is a question that it really is larger than just the specific changes that have been made now. None of the things that have been passed in the reconciliation bill help address and drive down that problem. Next week, we're going to cover what RFK said. The hearing was today. I was just on a national policy call, and apparently it was a doozy that I was told, hey, you got to go watch it. So there was lots of stuff said. We'll try and do our best to cover it next week. If you are interested in watching the full hearing, this is where you can find it on the Finance Committee. The recording is archived. Moving towards what the administration has been doing, again, there was a recent interview Monday, September 1st, that repeated a message we've heard before. You might remember a few weeks ago, we covered an executive order that was framed as being about crime. However, there was a lot of language in it that said that essentially connected crime to homeless people and homeless people to being people with mental illness. And part of the language of that executive order was encouraging involuntary commitments and institutionalization of the homeless because they, kind of equating homeless to people who are mentally ill. And a number of advocates, kind of quickly released statements about that. Because it's no joke to, involuntarily lose your civil rights and end up in a place that you do not agree to be in, for unknown reasons. So the same style of comments occurred in an interview Monday, again connecting that the policy idea of putting more people in institutional settings is going to make America safer. At least he admitted it would be very expensive to do that. He actually used the term insane asylums, and it's unclear what he meant by that. But generally, that's a term associated with a kind of psychiatric institution where, people other people decided were mentally ill could be kept there for months or years, often in bad conditions and often with no particular pathway out. So it's noteworthy in the sense that, this is again a second comment about using institutions as a way to get certain kinds of people off the street, under the idea that if you remove those people and put them in an institution, everyone else is safer. There have been many changes over the last several months at the Centers for Disease Control. We have not covered many of them, largely because there has been so many other things going on. But you may remember in March that as part of many agencies and many people, federal employees losing their jobs, there were large cuts of staff and employees at both the National Institutes of Health and the Centers for Disease Control. There have been, in the last few months, advisory panels where the current panel of experts have been summarily dismissed and replaced with people who do not have the same background in medicine or expertise in vaccines. There have been some advocates who have been worried about changes in vaccine recommendations, and those vaccine recommendations not covering as many people as they had previously, and in fact making it harder for folks to get a vaccine. And there's also been some coverage about how these policy changes impact vaccine supply and readiness, and whether or not insurance companies will cover vaccines that are no longer recommended for certain kinds of populations or people. Last week, Friday, again, not only did the Centers for Disease Control administrator, the head person at CDC, it's unclear if she was fired or resigned. It's a very strange situation. It is clear that some 4 to 5 really head people who are internationally renowned experts in infectious disease saw that dismissal or saw that conflict and also resigned. So we have now had a mass resignation of highly, people who are at the top of their field at the CDC, plus this week, additional employees who are raising a lot of alarm. And I've never seen resignation letters like this, but the people who are leaving are saying, I cannot stay in an organization that is doing things that we don't believe are in line with scientific understanding and or are actively harmful for public health, which is a pretty strong statement from workers. So we will see, we will continue to follow this, and I'm going to raise it here in the sense that, there have been a lot of folks, especially our rare disease community friends, who have been directly impacted by some of the cuts at the National Institutes of Health, because the federal government has been one of the few places that has devoted research into things that are rare. That isn't necessarily where the private sector puts its money. That's also true for vaccines, by the way, that there isn't a tremendous amount of profit margin in vaccines. And some of these cuts in the CDC and other policies are going to perhaps impact whether somebody who needs a vaccine or wants it can get one, and how much that vaccine costs. And if it costs too much, that means that there are a lot of people who may want one or need one who can't get one. The other reason this is a disability issue is there are lots of people who, for whatever medical reason, may not be able to get vaccinated. Those people rely on all of the rest of the population having enough vaccinations so that they don't get sick. This was really a big point of discussion in the pandemic, in COVID, that lots of people couldn't get the vaccine for various reasons, and they really needed as many people to get vaccinated as quickly as possible to reduce their risk of being exposed to or getting the disease. So it is an issue that impacts people with disabilities and people with special medical conditions pretty directly. And it does seem like even today, there are states that are now saying we no longer trust the CDC's recommendations. There's a group of states in the West that's kind of forming a coalition to make their own recommendations. Florida is deciding to remove any recommendations to vaccinate children. So we really do have some very rapid changes on how states are approaching vaccines that could mean that there are many more people who are going to end up not being vaccinated for some fairly common childhood diseases and other things. The Centers for Disease Control is launching a new pilot. First of all, Wisconsin is not one of the 6 pilot states, so I'll start with that. But a lot of times, a federal agency will do a pilot, and then they will make that policy the law of the land for all the other states. So it's always worth knowing what CMS is trying out, so to speak, because what they try may end up what they end up doing for everyone. So they are looking at traditional Medicare and applying prior authorization. A lot of folks in our community may be aware of prior authorization, where you don't get direct access to a treatment or even a specialty provider the first time you ask. Somebody, usually at an insurance company, has to examine that request and decide to grant it. There are lots of people who have experienced, delays in care because they haven't had a prior authorization approved, or it's been approved, but the distance between when the request was made and the approval was given was pretty long, and then you have to wait for an appointment. So lots of people have experience with prior authorizations in the healthcare system, and a lot of people don't like it very much. It is a strategy and a tactic that is used to drive costs down, largely because people don't get access to the care right away. And what the federal government is doing is 2 things. They're planning to implement prior authorization on certain kinds of procedures, but they're also planning to hire private companies to use artificial intelligence to decide whether patients can get those procedures. So it seems like the idea is that the AI is going to be determining and making approvals or denials on the prior authorizations. The other thing that is of note here is that the way they've designed the pilot, it appears that the AI companies have more of an incentive financially to deny claims, because Medicare plans to pay them a share of the savings that are generated from the rejections. This is not necessarily new. Maybe we haven't called it AI, but there have been several big lawsuits against insurance companies who have used a similar approach, where they've let a computer algorithm decide for them who should be approved or not. And they've used those algorithms to deny lots of people all at once. So big batches of denials come at the same time. In a similar vein, Social Security is now using chatbots. Again, Social Security they fired a number of employees, about 7,000 employees in the spring, and they've made a number of changes in how they do things. One of those changes is using an AI chatbot that appears to give kind of generic answers to questions that are probably frequently asked questions. And that may be helpful if you have a question that is pretty generic or one of the frequently asked questions, but it appears that it is not helpful for a lot of the folks who actually have substantive questions that used to be answered by and handled by experienced Social Security Administration staff. So this is a pretty big article, but I think it's worth looking at because the question, the example, the person that they're using as an example is somebody very much like a lot of the people we know who is asking a really in the weeds question about what do I do for SSDI to make sure that this amount of money isn't clawed back? Like that's a question that is fairly common for people that we know that the AI chatbot is not able to answer. And of course, many people who are calling for Social Security for help, who are older or have disabilities, are being pretty frustrated with a technical thing that is not responsive and doesn't get them to the right staff. Just to give you a scale of how many people, if 41% of your customer service calls are now being answered by this AI chatbot, I imagine some number of those people are not able to get the answers that they need. And if you are one of them, if you can't get through, or if the answers you're being given don't seem right, constituent services is an option for you. Members of Congress need to know how their federal agencies are handling routine customer service stuff. And Social Security is really important. There's 74 million people who receive those benefits. 11 million are people with disabilities. And these are the people that if that Social Security payment isn't on time, they're most likely to not be able to absorb, they don't have enough extra to cover a few days. They need a problem resolved now. So if you're having trouble or you've been frustrated with this kind of chatbot or customer service approach and it's cost you, you can always call your US representative and senator and have them open up a constituent case and make sure that they know that these changes that have been made are actually not helpful, that they are harmful to the people who are trying to get more clarity on what they need to do. Last week, maybe the week before, maybe a couple of weeks, we've been covering some of the comments that the president has made regarding voting. There was an executive order that he signed in March that tried to assert that only citizens could vote. He made another reference this last month talking about wanting to do another executive order to ban mail-in voting and certain types of voting machines. It's important to know that executive orders, like states run elections. State laws and state people are the ones, local people are the ones who have their own rules about how elections are conducted and run those elections. So an executive order isn't changing state law. It's not changing federal law. It may convince federal agencies that they need to change their policies to be more in line of the executive order, or it may be a signal to states, hey, if you change your laws in a way that conforms with my executive order, I'll like it. But nothing about the executive order changes state voting laws. What's noteworthy here is that once again, the idea of an executive order being used to convey or change how people are voting is coming up again. This time it's on a different topic. Added to the mix is requiring voter identification for all US elections. There's certainly states that do have a voter ID law. Wisconsin is one of them. So some of these are ideas that have been around for a long time, and states have done some of them or not in various degrees. And he once again repeated that he intends to restrict mail-in voting with a few caveats. So it's whenever there's something that's said multiple times, I think it's worth noting that that's a pattern. Certainly for many people with disabilities and older adults, the Disability Vote Coalition has been very consistent over the last decade about how voter ID requirements may limit access to certain kinds of voters from being able to vote, certainly non-drivers who have a hard time getting a state ID, people who are old enough where they maybe don't have a copy of their birth certificate, lots of those reasons. Mail-in voting, again, has been a very big topic that has been important to people with disabilities and older adults. And, certainly other things that the president has been talking about with related to voting are all issues that advocates have worked a lot on within our own state to make sure that lawmakers understand changing the parameters of those things does limit the access people have to the polls in ways that really does mean lots of people from certain groups are much less likely to be able to exercise their right to vote. And our last slide, last week, we covered a couple of things. First of all, over the last month, we've been covering various estimates that Wisconsin has had come out from our fiscal bureau, from the Department of Health Services, about what are the increased costs or budget holes that will be caused by HR1, both for food assistance and Medicaid, and what are the increased costs and potential budget holes that are caused by HR1 for the ACA marketplace. Lots of states are having the same kind of questions about, okay, what did we not plan for? And I think that this is going to be an ongoing conversation. This isn't like one number and then it's clear, right? But Colorado had a very instant budget problem because they tie their revenues to the federal tax code. And there was a lot of changes in the federal tax code in HR1. So last week, we saw Colorado be one of the first states that had to start wrestling with an unexpected state budget hole. I think they had almost $1 billion in an instant budget hole. And the governor was really clear, like this initial action that they were doing right now was going to be the first of what he thought would be several rounds of state budget holes that are going to come in waves because of HR1. And the reason I want to follow this one is because for those of you who have been on these webinars for some time, we have kept saying states only have a few tools to be able to balance their budgets. One of them is raising revenue, right? Getting more money in from state taxpayers to cover things, or letting less money go back out, right? Like maybe you get rid of some tax breaks that people have that mean they don't get as much back, right? Those are both ways that you either get more money in or keep revenue that you've already gotten, or you make budget cuts. And we've been saying that Medicaid, because it is such a big proportion of every state's budget, is a prime target because it is so large. And the only way that you really can cut Medicaid is to change who gets in other words, reduce the number of people who are eligible to get into the program, reduce the amount, change what is covered under the program, right? Create wait lists, so people who are eligible, but they don't get the services until a slot opens up, or essentially reduce the amount you pay people who do the work of Medicaid get. And Colorado did several things to close up this initial budget hole. One of them was to cut Medicaid reimbursement rates for providers. And you can see they made several other cuts to programs. They raised taxes, and they used 300 million from their state's rainy day fund. So Colorado did a mix of things to close up their initial budget hole, but one of them was about Medicaid. And if you're a provider in Colorado who was used to getting paid one amount to serve Medicaid patients, and now it's less, that may be the difference between that provider continuing to serve Medicaid patients or staying in business. And you can kind of see how that decision about cutting rates may actually mean that there are fewer people willing to take Medicaid patients. So you haven't really, maybe you haven't cut anybody off the Medicaid rolls, but if they don't have access to the services they need because no one's willing to take the amount of money that the state's willing to pay, it in fact has the same effect. So we will continue to watch what other states are doing and keep you kind of informed about new estimates that are coming out for our state. But I think we should expect that every state, including ours, is going to have to find more money to cover either the cuts in federal spending that, the less federal money coming into the state, or more costs that the state didn't have before that the federal government is requiring states to pay. We should expect that in the near future, that will come up for SNAP, and there might be a couple more potential budget holes that are from HR1. We will see if there are additional cuts or changes this fall in either the federal budget or other legislation that make those budget holes bigger for our state. And with that, I hope everybody has a really good weekend. We will be back live next week for a webinar on Friday. So we will get you your after message with the registration links, the slides, the recording, and every link that we included in this presentation.